Diamond is an important ornamental material with a high refractive index of about 2.417 to 2.419. Its refractive index is higher than that of emerald and sapphire. It is also the hardest substance on Earth. The shape of diamond is similar to an important anatomical area that is known as Popliteal Fossa. In this video, we'll be talking about the borders, the contents, and the important clinical conditions that are associated with the Popliteal Fossa. So you just have to tighten your seatbelt because it's going to be a smooth ride. Like we said, Popliteal Fossa has the shape of diamond. It is located at the back of the knee. Wait, did I just say back of the knee? Please, let's be professional here. It is located at the posterior aspect of the knee. Okay? Don't get confused. Posterior and back are the same thing. It's just that posterior is anatomical language, so we just have to speak it fluently, alright? The major function of this area, this anatomical area known as Popliteal Fossa, is that it is the major part through which nerves and blood vessels pass between the thigh and the leg. Let's talk about the borders of the Popliteal Fossa. Like we said, it is a diamond-shaped area, and as a diamond-shaped area, it has 4 borders. These borders are actually formed by the muscles of the posterior compartment of the leg and thigh. The first border is the superior-medial border, which is formed by the semimembranosus. The second border is the superolateral border, which is formed by the bicep femoris. The inferior-medial border is formed by the medial head of the gastrocnemius muscle. The last border, which is the inferiolateral border, is formed by the lateral head of the gastrocnemius and plantaris muscle. It is important to note these anatomical terms for easier understanding, but that's for another video entirely, where we'll talk about the anatomical terms and its meanings. Having talked about the borders of the Popliteal Fossa, let's discuss the contents of this area. But before then, I would like us to note that the floor of the Popliteal Fossa is formed by the posterior surface of the knee joint capsule, the popliteus muscle, and the posterior femur. Okay? As for the roof of the Popliteal Fossa, it is made of 2 layers, the popliteal fascia and the skin. The popliteal fascia is continuous with the fascia lata of the leg. Let's now talk about the contents of the Popliteal Fossa. Like we stated earlier, Popliteal Fossa is the main conduit for the neurovascular structures entering the leg and leaving the leg as well. Its content from the medial side to the lateral side are the popliteal artery, the popliteal nerve, the tibial nerve, and the common peroneal nerve, or you can also call it the common fibular nerve. The tibia and the common fibular nerves are the most superficial contents of the Popliteal Fossa. These 2 nerves both branches from the sciatic nerve. The common fibular nerve follows the bicep femoris tendon. Both of them travel along the lateral margin of the Popliteal Fossa. A vein known as the small saveinous vein pierces through the popliteal fascia and passes between the 2 heads of the gastrocnemius to empty into the popliteal vein. As for the popliteal artery, it is the deepest structure of the Popliteal Fossa. It's a continuation of the femoral artery and travels into the leg to supply it with blood. That is all about the Popliteal Fossa. But it wouldn't make sense after describing the anatomy of this important anatomical area without talking about clinical implication that is associated with it. The clinical relevance we will be talking about is the swelling of the Popliteal Fossa. The appearance of a mass in the Popliteal Fossa has a lot of differential diagnosis. We're going to be talking about the 2 major causes of this swelling, and they are the Baker cyst and aneurysm of the popliteal artery. At this point in time, I would encourage you to visit our video on aneurysm so that you can have a better understanding of what it's all about. Baker cyst, which we can also call the popliteal cyst, refers to the inflammation and the swelling of the semimembranosus bursa. This bursa is just a fluid-filled sac that is located in the knee joint. The Baker cyst usually arises together with osteoarthritis in the knee. The cyst can rupture and produce symptoms similar to that of deep vein thrombosis. Let's talk about the other cause of swelling of the Popliteal Fossa, which is popliteal aneurysm. Please go back and check our video on aneurysm in order to understand better. But still note that aneurysm is a dilation of artery more than 50% of its normal diameter. The popliteal fascia is tough and cannot be extended so easily. So this will bring about the other contents of the popliteal fossa to be affected. The tibial nerve is very easy to be compressed. It is particularly susceptible to compression from the popliteal artery. The major features of popliteal nerve compression are: firstly, there will be weakened or even complete absence of plantar flexion. Secondly, there will be paresthesia of the foot and posterolateral leg. If I may ask, what is paresthesia? Paresthesia is an abnormal sensation that looks like tingling or pricking. It is caused chiefly by pressure in the peripheral nerves or even damage to that nerve. Let's not digress. Okay, let's come back to what we are discussing. Aneurysm of the popliteal artery can be detected by a well-seen palpable position in the popliteal fossa. Other causes of popliteal mass, although they are not so common, are the deep vein thrombosis, the adventitial cyst of the popliteal artery, and various neoplasms such as the rhabdomyosarcoma. Thank you so much for watching my video, guys. My heart is filled with gratitude. Good quality videos will be coming in. Please share my videos with your friends and also subscribe. Also, do good to your neighbor. A smile, just a smile, can change a whole lot of things. See you in the next video. Until then, God bless you. God got you. Peace.